Hello, welcome back everyone. So let's continue with acid-base balance part 2. Like previously I mentioned, the normal range of pH in our body is 7.35 to 7.45, and the causes for acidosis could be respiratory, where there is retention of carbon dioxide such as hypoventilation, sedation, decreased respiratory rate, or obstruction like COPD, asthma, pneumonia, hypoxia basically. And there could also be conditions such as alcohol intoxication, opioids, we all know it brings down the respiratory rate. Okay, benzodiazepines, any sedatives, or post-op. So these are the causes for respiratory acidosis. Then we have metabolic acidosis, which could be renal failure. If your kidneys are not functioning, it is not able to excrete the H plus ions. It could lead to an increase in the acidic level or a drop in pH, that is acidosis. Or also metabolic acidosis could happen if there is diarrhea, where you're losing a lot of your intestines are rich in bicarbonate. You're losing bicarbonate. So again, it could lead to acidosis. More than 7.45 is alkalosis. Like I mentioned, respiratory alkalosis could be conditions where there is hyperventilation. You're breathing rapidly, you're washing out carbon dioxide. So you're removing the acid from your body, so it goes into alkalosis. Conditions could be anxiety, panic attacks, or these are the causes for respiratory alkalosis, right? Then you can also have metabolic alkalosis in conditions such as vomiting, because you are vomiting out the stomach acids. So you're losing acid, so it becomes basic or alkalosis. So that is metabolic alkalosis. Now let's move on to what should we be looking at. So the problems, it could be in the form of a clinical scenario. When it is a clinical scenario, it is easy because you know if the condition is respiratory or is the condition metabolic. If it says vomiting, diarrhea, kidney failure, you know it's metabolic. If it says the patient is a COPD case or a long history of asthma, you know it is a respiratory case. But say you don't know the condition, so you just look at the values. The first thing you look at, the most important, is the pH. Look for the pH. Is it within the range? If it's within the range, it's normal, or it could be compensated. That is, the pH was abnormal, but our body compensated. Then we move on. So it could be either there is a discrepancy in the pH, there is a drop in the pH, that is acidosis, or there is a increased pH, alkalosis. So it could be uncompensated, meaning the abnormality is still there. It could be partially compensated, meaning the body is trying to bring it back to the normal pH. And it could be fully compensated, that is, the pH was brought back to normal. But the first thing we look at is this. With this, we determine if it's an acidosis or an alkalosis. Second thing we look at is the CO2 level. So the normal range should be within 35 to 45 millimeters of mercury. So if it is more than 45, that is, if the PCO2 is high, it becomes acidosis. If the PCO2 is low, it becomes alkalosis, right? So if we first, then we look at the CO2. So if the CO2 is high, we say it's respiratory. If the CO2 is low, we would say it's respiratory alkalosis. Third thing we look at is the bicarbonate level. The range is between 22 to 26. Now, if the bicarbonate level is high, it is alkalosis. If the bicarbonate level is low, it could be acidosis. Or again, bicarbonate means it could be metabolic. But the order is first the pH, then the CO2, and then the bicarbonate. Similarly, we look at if it's compensated, uncompensated, or partially compensated. So I've kept some problems which includes all these scenarios. So I have written the values in this order. First the pH, then the CO2, and then the bicarbonate. So in scenario 1, the pH is 7.25. So the pH is less than 7.35. So now we know this is a case of acidosis. But now we have to determine whether it is metabolic acidosis or respiratory acidosis. Second thing we look at is the PCO2. PCO2 is 55. It is more than the normal range. So it is, CO2 means respiratory. So this is a case of respiratory acidosis. The bicarbonate level is within the range. So this is uncompensated respiratory acidosis. Second question. Second question says the pH is 7.57. So the pH is high. So it is alkalosis. We know it is alkalosis. Now second thing is we have to determine whether it is respiratory or metabolic. We see the PCO2. The CO2 level is less than the normal. So now it is respiratory alkalosis. Again, it is uncompensated because your pH is high, not within the normal range. Third scenario, the pH is low, so it is acidosis. The CO2 is 39, which is normal. But the bicarbonate is 19. It's less than 22, right? And therefore, it is a case of metabolic because your bicarbonate has dropped, and acidosis. So this is uncompensated metabolic acidosis. Now moving on to the slightly trickier questions. Here the pH is 7.32. It's close to 7.35, but it is still less. So it is acidosis. Your CO2 is high. So it is respiratory acidosis. But look at the third parameter. We cannot ignore that. This is also high. So this indicates because there is respiratory acidosis, your body is trying to compensate it, bring it back to the balance. That is why it said acid-base balance. Because there is respiratory acidosis, the pH is dropped, your body is trying to do metabolic alkalosis so that things are back to normal. That is why your body has increased the production of bicarbonate. So it is trying. And therefore, we would say this is a case of partially compensated respiratory acidosis. It is respiratory acidosis, but your body is trying to do metabolic alkalosis, compensating for the acidosis by increasing the bicarbonate. The last scenario is 7.37. So this is neither acidosis nor alkalosis. The pH is normal, but the CO2 is high. That means there was acidosis, right? And the bicarbonate is also high. Now, how do we determine? Now we know, since the pH is normal, we know that it is compensated. But looking at the second and third parameters, we also know there was some abnormality. Now 7.35 is closer to 7.3, the 7.37 is closer to 7.35 than 7.45. So let us say, because we know although our body tries its best to bring it to normal, it will not overcompensate, right? So it has just managed to bring it to the normal range. So this is an example of fully compensated respiratory acidosis. Next class, we will do some more case scenarios. Thank you. Until then.